Dr. Marlene Sampson, the nursing program administrator at Mount Carmel College of Nursing. Nice to meet you.
Thank you. It's nice to meet you.
Yes, first of all, happy Nurses Week to you.
Thank you.
For anyone interested in nursing, or maybe not, why is this such a good career to choose?
Nursing is a profession that opens a world of opportunity, and that includes working at the bedside with patients. It could be working in education such as we are, but there's so many things in nursing that you can do that offers job security, great benefits, and great pay, and it's a good time to go into nursing.
So today we are going to demonstrate how to tracheal suction. So what I'm going to show is the fact that our patient has a trach and he is connected to the ventilator. So what we're going to do is we're going to make sure our suction is on, and it is. If you push down, you'll feel suction. And we're going to just slowly introduce until he elicits a cough. Once he elicits a cough, then we're going to slowly pull back out, applying suction as intermittently as we're pulling out. So we're going to insert, 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 and when he starts to cough about here, we're going to pull this out and we're going to slowly suction. And we want to try to have our suction done in 15 seconds because we're literally taking these patients' breaths away.
Students here at Mount Carmel have the opportunity to learn in a real-world atmosphere. So we try to mimic what they're going to see on the clinical units. And that really helps with their critical thinking, their muscle memory, and just making the connections that they're going to need when they leave academia and go into their practice. We have our pumps, our vents. They can practice suctioning here, our head wall, which includes like the oxygen and the suctioning. These are things that they're going to see, and they're usually afraid of when they walk into a patient's room, but they'll get some exposure here so that they're more prepared to practice when they get to that bedside experience.
We want to be sure that that is up and into the tubing, not still into the trach itself, because that's where the suction comes out, and it would occlude his breathing. This is an automated medication dispensing system, and you have to sign in using a fingerprint. So the Pyxis allows for the medication to be removed safely. So why don't one of you come here and we'll practice going through removing the medication. So the first thing you're going to do is you're going to select your patient, and let's try John Martinez and see what he's got ordered. So let's go ahead and remove this aspirin, and it's saying that he has an aspirin, 81 milligrams, so go ahead and hit remove med. And when it opens, it's going to tell you the dose that is ordered and the dosage of the medication itself. And then it tells you which pocket it's in. So we're going to find pocket 12, correct? And then we're going to look at it, and we're going to hold it up here, and we're going to verify that it is a 81 milligram aspirin. Okay, we're going to go ahead and hit accept, and it tells you to close the drawer.
Our goal here is to bring the clinical into the classroom, but also bring the classroom into the clinical.
At Mount Carmel College of Nursing, students are very fortunate in that they begin their clinical experiences fairly early in their education. Our traditional undergrad students, they start the clinical experience and the lab experience their sophomore year. And then we have our SDAP, or second degree accelerated program students, who will be in the lab on their first term and for 6 weeks. And after that 6 weeks, they go into the clinical environment. Taking care of patients like this and getting their hands on to practice so that when they're graduated, they're ready to go on to their practice of nursing.
Michaela, what is it that you really enjoy about nursing?
With nursing, I love that I get to help people, and I would love to spread God's love within my work. And I think it's important for everyone to know that nurses genuinely do care about them and their well-being.
Where can people go if they want to learn more information about the programs and maybe even applying to the school?
Absolutely. For any information on any of our programs, they can go to mccn.edu.